My name, again, is Nancy Kennedy. I'm a special agent with the FDA Office of Criminal Investigations, also known as OCI. For many of you that may not know, OCI is just a small little division within FDA that conducts criminal investigations involving violations of the Food, Drug, and Cosmetic Act for all products that are regulated by the FDA. I currently serve as a Senior Operations Manager of Drug Investigations in the headquarters office of OCI. I feel my role here today is to tell you about a real criminal investigation or two that illustrate how counterfeit drugs and substandard drugs can make their way into the U.S. pharmaceutical supply chain. I'll tell you about some obstacles in conducting investigations that involve drugs in the supply chain and some things FDA is trying to do to secure the supply chain. I feel like I should also tell you ahead of time that I'm really just an agent criminal investigator. I'm not a supervisor, and that decisions about legislative proposals and the needs of my agency are made way above my head. So if you ask a question later that I can't comment on, I hope you understand that. But please also understand that as some of you in the audience, the business of you is pharmaceutical manufacturing. My business is criminal investigations. I know these investigations involving counterfeit drugs and the supply chain. I've been involved in them for a long time. These investigations are my business, and I am passionate about them, as are all the other OCI agents that are committed to working them. I'd like to tell you about a case that began in 2003 by the OCI office in Kansas City. The office was investigating a licensed drug wholesaler named Albers Medical for distributing diverted and suspect counterfeit drugs. During a search warrant they conducted at Albers Medical, the owner made a statement to the OCI agents that he had recently purchased Lipitor from a company in Puerto Rico, and that he was having that Lipitor repackaged by a licensed repacker named MedPro. Repackaging of pharmaceuticals is illegal and necessary. For example, when bottles containing large quantities are purchased and need to be broken down into smaller quantities for distribution to other entities. Although this practice is legal, the OCI agents were suspicious of the companies involved in the sales and the purchase of this Lipitor, so they began looking into it. Sure enough, a few weeks later, notification came from Pfizer, the manufacturer of Lipitor, that they had discovered 2 lots of Lipitor that were counterfeit. These were in the supply chain. It turned out that the Lipitor from these lot numbers had been repackaged by MedPro for distribution by Albers Medical. Pfizer had received consumer complaints on this Lipitor having a bitter taste. It was determined that the bitter taste was due to cracks in the counterfeit Lipitor that were made by the counterfeiters when the pills were compressed way too much in the pill press. The investigation of this counterfeit Lipitor spanned years. The FDA coordinated a recall of approximately 18 million Lipitor tablets. It was a massive task for the OCI agents to try to track all the counterfeit Lipitor through the U.S. pharmaceutical distribution system in order to identify the culprits involved in this scheme. Many drug wholesalers and brokers were involved. False pedigrees were used to disguise the true source of the drugs. For those of you that aren't aware, a pedigree is like a traceback document that in essence travels with the drugs and reflects the previous sales of the drugs. The elaborate scheme led the agents overseas to Costa Rica and Nicaragua, with other ties being identified in Brazil and Hong Kong. A few prosecutions are still pending in this case, but to date, OCI and the U.S. Attorney's Office have achieved about 22 felony convictions in this case. In another case that began in late 2006, OCI and ICE, Immigration and Customs Enforcement, in Houston began an investigation into the distribution of counterfeit drugs by a Chinese national named Kevin Xu. Many of you have probably heard of this case. Xu sold undercover agents counterfeit Aricept, which is treatment for Alzheimer's, counterfeit Tamiflu, counterfeit Zyprexa, which is a treatment for schizophrenia and manic depression, counterfeit Plavix, which is a cholesterol-lowering drug, and counterfeit Casodex, which is a drug for the treatment of prostate cancer. In July 2007, Hsu met with undercover agents believing he was meeting with a U.S. doctor and that doctor had a way to distribute large amounts of counterfeit drugs by getting these into the U.S. pharmaceutical supply chain. In that meeting, Hsu stated that he could supply all the counterfeit drugs they needed and that he could copy the U.S. packaging on for any drug. He was arrested following that meeting. Although Hsu's counterfeit drugs did not make it into the U.S. pharmaceutical supply chain, they did in fact make it into the UK pharmaceutical distribution chain. The result was a huge recall in the UK of Zyprexa, Casodex, and Plavix. Hsu was prosecuted in the U.S. in January 2009 and was sentenced to 78 months in prison. Those are two examples of how counterfeit pharmaceuticals did or could have made their way into the U.S. pharmaceutical supply chain and on to consumers. Are there other instances of actual counterfeit drugs getting into the supply chain? Yes, but they are few and far between. We have been lucky. Today, the same conditions and loopholes surrounding the supply chain exist that existed in 2003 when the counterfeit Lipitor entered the supply chain, and in 2007 when Kevin Hsu was trying to get his counterfeit drugs into the U.S. supply chain. These conditions that exist are allowing for the diversion of prescription drugs outside the normal distribution chain from manufacturer to patient. The diversion undermines the integrity of the nation's supply chain and poses a threat to public health. Illicit drug diversion is a path and a method through which counterfeit, adulterated, misbranded, unapproved, and just plain unsafe drugs can enter the supply chain and ultimately be distributed to patients. Illicit drug diverters operate outside the legitimate distribution system and deal in discounted drugs from questionable sources. The drugs obtained from these sources are often stolen, expired, or counterfeit. These drugs are often repackaged by the drug diverters into counterfeit labeled packages and bottles. They're sold to drug wholesalers who turn a blind eye to the true source and condition of the drugs. It is not at all uncommon for these repackaged drug bottles to contain the incorrect strength of the drug, the wrong drug altogether, or other items such as candy or aspirin. The storage and handling conditions of these diverted drugs is questionable at best. Although counterfeit drugs getting into the supply chain, such as they did in the Lipitor case, is rare, drug diversion is not rare. It is in fact very common. In response to concerns about prescription drug diversion, Congress enacted the Prescription Drug Marketing Act, PDMA, in 1987 to prevent the distribution of counterfeit, misbranded, adulterated, or expired medication to American consumers. Due to various industry objections and legal roadblocks, to date, FDA has been unable to fully implement its PDMA regulations. This lack of full implementation allows for loopholes and openings in the otherwise closed distribution system. Drug diverters are aware of these loopholes and exploit them. Another complication is that prescription drug wholesalers are licensed by the states from which they operate. Those states are also responsible for inspecting the wholesalers and have very limited resources to conduct these inspections. Because the licensing and inspections are handled by the states, at any given time, FDA cannot tell you how many licensed prescription drug wholesalers there are and who they are. On top of that, various states have or are attempting to enact their own laws and regulations governing the wholesale pharmaceutical chain. From my perspective, these differing laws and regulations in various states make conducting these investigations even more difficult. There are other threats to the U.S. pharmaceutical supply chain, such as doctors and clinics obtaining drugs from unknown sources over the internet and from overseas wholesalers, and then administering these drugs to unknowing patients. And delving deeper, it is very difficult to monitor the supply chain when the majority of the manufacturing and sources of drug ingredients are in countries outside the U.S. This was evidenced when the contaminated heparin reached the U.S. A secure supply chain is the key to preventing unsafe drugs from reaching the unsuspecting public. To that end, FDA is in the process of launching a new program called the Drug Integrity and Security Program, or DISP. This new program will address supply chain threats, focus on the life cycle of the product from drug components through the finished dosage form delivered to the patients. This program will also attempt to work on new and coordinated approaches and policies and enforcement strategies. FDA is also actively developing standards for track and trace and authentication for prescription drugs in the U.S., as was called for in the Food and Drug Administration's Act. And lastly, OCI continues to make criminal acts that involve threats to the pharmaceutical supply chain, such as drug diversion, priority criminal investigations. I appreciate the opportunity to speak today, and I appreciate that there are forums like this that are bringing the attention to the issue of counterfeit and unsafe drugs and securing the supply chain. I think that we can fight the battles of counterfeit drugs coming in from other countries and being sold over the internet. But the only way to win the war is to also further secure the U.S. pharmaceutical supply chain. Thank you.